the public health approach, if it works, is by far the most efficient because you lock down just a very small proportion of the population, the infected people. So if we magically knew all who were infected, all we'd have to do was keep them isolated for 7 or 14 days, and the epidemic would go away, assuming that you're also blocking new arrivals. Amazingly efficient. A small group of people are identified, are isolated, kept from general circulation, and the epidemic goes away. In fact, you don't have to have 100% success rate in that. The name of the game is to stop the number of infections from being greater than 1 from each infected person. So we want what's called the effective reproduction rate to be less than 1. That doesn't mean that you stop every infection. It just means that on average, you prevent an infected person from infecting more than one other person. And that can be done by testing and isolating and tracing many of the contacts, not all of them. So public health, and by enforcing face masks in public so that any contact between an infectious person and a susceptible person is less likely to transmit the disease. By and large, this has been the East Asian approach. Keep people away from China, monitor incoming arrivals, later on quarantining them, and then using testing, tracing, and isolating, as well as physical distancing to keep the effective reproduction rate less than 1. Australia has done it, New Zealand has done it, Taiwan has done it, Hong Kong has done it, Japan has done it, Korea, I think I said, and China did it after the first complete blowout in Wuhan. But it did get this under control. And epidemiologists use the data to calculate the effective reproduction rate by day. And you can ask, are we under 1 or are we greater than 1? And Australia is consistently less than 1 in recent weeks. And this means that the great numbers of infected are going down over time. And the deaths in Australia are 103 notified COVID-19 deaths in total for Australia's population of 25 million. In the US, we have 107,000 deaths. So 1,000 times the number of deaths of Australia, but our population is about 13 times larger. But we have 1,000 times more deaths. So you can see what a chaos we have.